Today, I'll speak about physical touch in general and more specifically, touch in psychotherapy and counseling. Touch is one of our five senses. Some would argue the most important of the five. After all, we can live without sight, without sound, smell, taste, but not without touch. Touch is not only a fundamental requirement for our well-being and development, it is in of itself, it also has a power to heal. Yet, the amount of touch people receive across different cultures varies significantly. I'll discuss today my deep concern regarding the general risk management beliefs that non-sexual touch is likely to lead to sex, and therefore psychotherapists, social workers, counselors should not use touch beyond a handshake. Mm-mm. I'm Ofer, PhD, licensed psychologist, ethicist, instructor, expert witness, author, and most importantly, an anthropologically critical thinker. I have written, lectured, and published extensively, as well as testify in court on the ethical issue and standard of care of touch in mental health services. We can start with the exploration of cross-cultural perspective. A classic research study quantified the number of time friends in a different culture touch during a regular 1 hour meet up for coffee. In Puerto Rico and the Middle East and in Latin America, the friends touch 180 times. Yes, 180 times. In Paris, France, they touch 110 times. In London, England, they didn't touch at all. In Gainesville, Florida, US, they touched twice. So when you look at the number 180, 110, 2, and didn't touch at all, it tells you how strongly the relationship between culture and physical touch. I myself come from Israel, where touch is so important, it's woven into the fabric of the Middle Eastern societies. It starts of who I am and how I communicate. It's part of who I am and how I communicate. It has been living in the generally touch-phobic United States now. I've been living here for 40 years and got in trouble for touching people in the cultures that sexualize most form of touch here in the US. Because I did not grow up in this culture, I have noticed in the US the definitely lack of touch in the culture at large, as well as in psychotherapy. And I believe it should be addressed, as touch is a powerful healing tool. And we psychotherapists are in the healing profession. Mental health professionals have been brainwashed by ethicists, attorneys, and primarily so-called risk management experts to avoid any touch with client beyond a handshake because, as a slippery slope myth asserts, most forms of simple or benign touch are likely to lead to illegal, unethical, counter-clinical sexual touch. How paranoid is that? Counter to the common beliefs that non-sexual or non-erotic touch, like many other boundaries crossing, are neither always unethical nor lead to boundary violation. Ethics code of all major psychotherapy professional associations such as AAMFT, ACA, APA, NASW, NBCC, CAMFT do not prohibit non-sexual, non-hostile touch in therapy. Of course, all of them view sexual or violent touch with client as unethical. However, a couple of this major code do not even mention the word touch in their entire code of ethics. So the mythology of that touching clients is unethical is kind of right now being dismissed. So let's dive into the profound and often underestimated significance of touch in the realm of human development as well as in therapy. Drawing inspiration from Ashley Montagu, 1971, groundbreaking work, Touching The Human Significance of the Skin. That's the title of his book. I would like to talk about the various dimensions of touch and its pivotal role in shaping our well being. Montagu's work highlighted the lifelong impact of touch deficiencies, emphasizing its pivotal role in the bonding of infants to caregiver. Cultural relativity plays a significant role, as I mentioned earlier, with Western culture, particular in America and England, being characterized as low touch culture. The intertwining of sex, love, power, and dominance in the Western society has led to a cautious approach to physical touch, with some even early parenting expert, cautioning against affectionate gesture to avoid sexualizing young ones. Oh my God. This is an unfortunate because touch has been recognized as a healing force for over 25 centuries. It unleashes a cascade of positive chemical responses, including a decrease in stress hormones, an increase in serotonin and dopamine levels. Massage, in particular, has proven to be a powerful tool in reducing anxiety, depression, and stress hormones. Massaging infants has been shown to make them more sociable, healthier, and more easily soothed. There are many types of touch in psychotherapy. I'll just give a few examples here: greeting touch, pattern playful touch, reorienting touch, task oriented touch, physical related to an injury touch, excited, happy touch, containment touch, intentional touch, ritualistic gesture such as handshake, and many, many more. So we won't go into one by one, but just to get you the incredible range of touch that is may be used in psychotherapy as part of the healing process. Obviously, it is crucial to distinguish between appropriate and inappropriate touch, with sexual, hostile, and punishing touch being strictly condemned as unethical and even illegal. I had a client, she was 75-year-old, and with history of extensive abuse. She was a model. She was beautifully by the standard of the culture. Didn't have much relationship with men or women. And she came to my office as psychotherapist patient twice a week for an hour, each hour, just for me to hold her hand. So we sat for an hour, $250 an hour, and we just hold hand. I could speak, I could talk in Hebrew, I could talk Swahili, I could talk whatever language, it didn't matter. She just wanted us to touch, only the hand, and she was focused on the touch and didn't listen. It didn't matter. I didn't speak much sometimes, and when I spoke, sometimes it spoke a different language. But we did it for 2 years, twice a week, an hour each, $250 each. But that's what she wanted. She wanted to be touched because she was either touched, punished. She was punished by parents, step parents, or she was sexualized by family member and later on because she was so gorgeous by the culture, by men in the culture, and being envied by women. So just being held by me, only the hands, was really healing force for her. So to the hesitancy, prohibition of touch therapy, including cultural tendencies, fear-based thinking, and concern about sexualization. Ethical consideration are paramount in navigating this complex landscape. I definitely believe in that. While touch in therapy is not inherently unethical, it should be employed only when likely to have a positive therapeutic effect. In my books that published by APA, in my numerous articles and lecture, I clearly state rigidly avoiding touch for fear of ethical or legal repercussion is considered substandard care. Risk management is not the standard of care. Ethical touch considers the context of therapy with emphasis of client's culture, view of touch, or relationship to touch, and of course, the therapeutic relationship. Clinically appropriate touch employed with sensitivity and clinical integrity can enhance therapeutic alliance and aid in emotional exploration, resolution, and ultimate healing. It seems to be the lack of training and supervision when it comes to touch that is behind the lack of incorporation of touch into psychotherapy. But even if you, the therapist, wasn't trained in utilize touch, it does not mean you cannot start right now after you listen to this YouTube. Here are some guidelines for therapists to follow. 1. Employ touch only with its aim to be clinically effective, when it has a clinical rationale for that. 2. It is within the therapist's training and competence to use touch. That means get some training, increase your competence. 3. Therapists should explore their own personal issues regarding touch and seek education, consultation regarding its appropriate use. Because you may have your own kind of fear, your own kind of history with touch. So you need to do kind of your own, as we say, kind of we need to do our own analysis, our own therapy to be effective therapists. Number 4, the decision to touch should involve through deliberation, considering factors such as client, culture, personality, safety, and empowerment. 5, obtain client consent and document in the record extensive touch. You don't need to document in the record that you shook his or her hand or pat on the back. But if it's a little bit more what I described that I had with my client sitting for hours just holding hands, it definitely was part of my record. Number 6, last one, take a special care when working with client who has experienced trauma, sexual abuse, or have specific concerns related to touch. I've worked with a woman who has been sexually abused by family members, boyfriends, husbands. When she wanted to hug me in the second session, I gracefully declined. It was 2 years and lots of conversation before I trusted that she would not sexualize the light hug we finally had at her request. So with all my background of culture and my the importance of touch, with this woman, I waited a couple of years before I gave her a light hug. In conclusion, the healing of power of touch is established and indeed profound. Its incorporation into therapy requires thoughtful, ethical, and clinically informed approach. Let's not give our fears and rigid risk management ways of thinking deprive our client from the immense potential benefits of touch. Let's embrace the richness, healing that touch can bring to the therapeutic process while remaining vigilante about the ethical consideration that guides us to using it. My website at drzur.com, drzur.com, includes numerous free resources on touch in therapy, ethics of touch, risk management, standard of care, boundary crossing versus boundary violation, and much, much more. I wish you well.